Discharge is common for every productive woman. Any woman that is within the age of reproduction is constantly having vaginal discharge. But the question is, what does your vaginal discharge say about your health? You need to know the normal to be able to differentiate the abnormal. You need to know the normal to be able to differentiate the normal. Your vaginal discharge says a lot about you. And as a woman in your reproductive age, you need to know the abnormal from normal or the normal from abnormal. So you're able to dictate when there is a problem. This and many more you will learn in this video. Please stay tuned and watch till the end. In this video, I teach about the good lifestyle. That's what you need to know, do to remain healthy. That's what you need to do to maintain your health status and enjoy your life maximally. You're welcome to this channel. If it is your first time of seeing this video, please kindly subscribe to this channel and stay tuned. Turn on your notification bell to get notified whenever I upload a new video. So, what does your vaginal discharge say about your health? It is paramount that you know so that you're able to differentiate normal from abnormal. First of all, vaginal discharge is what is constantly coming out of the vagina, the discharge that is constantly coming out of the vagina through your cycle as a woman. If you have 28-day cycle, if you have 20 day cycle, 21, 30, depends on what your cycle is. At every stage in your cycle, something is discharging. Starting from your menstrual period, the blood discharge, that is menstrual flow. There is bloody discharge, that is menstrual flow, showing that you are still in your reproductive age and you're still fertile. And it also shows that you are not pregnant. That is what your menstrual flow indicates. Then, after the menstrual flow, there are certain dry days. Immediately after your menstrual flow, there are certain dry days, like a day or two, depends on your body system. But immediately after that, you will begin to see pap discharge, whitish, very whitish, non-smelling, that will continue to come out. All this vaginal discharge helps to keep the vagina clean. It helps to clean up your vagina. They are very, very normal. Yes, they are normal. So at every stage, something is discharging. Then, immediately after the pap, you begin to notice some slimy, thin discharge until you get to your ovulation time. Then you will notice heavy egg white discharge, thick egg white, slippery, very thick egg white. That shows that you are at your fertile time. You are ovulating at that point. That is what it shows. Some say that they don't know about this egg white. Like I said earlier, it depends on your body mechanism. It is not a generalized thing, but obviously during your fertile period, you will notice that the mucus changes from being purplish, from being thick to slimy and slippery. That is it. Some days are very heavy. You will notice it and it will be very thick and slimy, like egg white. Then immediately after that, it begins to diminish and you begin to see some fluid discharge. Not too puffy, not too slippery. And that continues until your next menstrual flow and you begin to see blood. So at every point in time, this helps to keep the vagina wet and keep it clean. The vaginal discharge helps to keep the vagina wet and clean. as far as you're in your reproductive age. Then again, you need to know all this. All this I talked about now is not smelly, it is not abnormally heavy, it is moderate. Then when you begin to see thick, cuddy, and fishy smelly in your panties or when you clean up after using the toilet, something is wrong. It is a sign that you have gotten some infection like yeast or bacterial vaginosis. You need to see your health practitioner immediately. The reason is that when you notice any abnormal from your vaginal discharge, you need to treat it with urgency, because if you don't treat it immediately, it can lead to more serious problems. So that is why you need to immediately see your doctor or your midwife for appropriate management, treatment, so that you don't escalate to something more serious. So when you notice that your vaginal discharge is smelling, the color is no longer white. It could be brownish and smelly, and the discharge is heavier than abnormal. It needs urgent attention and you need to see your doctor. So please, your vaginal discharge says a lot about your health. And remember, when you are spotting in between your menstrual, after your menses, in between your menstrual cycle, it is also a sign that there is danger. So you need to consult your doctor immediately. Do not forget that health is wealth and prevention is better than cure. So make a smart move immediately you notice any smell, especially and heavy discharge. Candida, that's yeast infection, is common. It's common. And one of the signs is that you will notice heavy, cordy, like cheese coming out in your panties or when you clean up after using the toilet. It is call for action. That is a tip or one of the signs of candida. And once you notice you are having itchy around your vagina, around your vulva, in your private part, please do not hesitate to seek immediate attention for proper management to avoid regretting, waiting, or wasting time. As a woman, especially if you're still in your reproductive age, if you're still believing God to give birth to children, this is paramount to help you. Thank you for watching. Please don't forget to like this video, share. Some people need to hear this. Share. It is very, very important. Like and comment. And do not forget to ask questions if you don't understand. Let me clear you. Thank you. Remember, it's your favorite nurseology on the show. Remember to subscribe if you're not. Thank you for watching and watch out for more. Keep it simple and stay healthy. Bye.